Good afternoon, everyone. Welcome to another episode of Longstreet Clinic's Facebook Live event to discuss the COVID-19 pandemic. My name is Dr. Ricky Locicero, and I'm a hematologist oncologist at Longstreet Clinic Cancer Center. I'm here today with three of my colleagues from Longstreet Clinic, Dr. Connie Osorio, an OBGYN, Cheryl Williams, a registered nurse and longtime diabetes education coordinator, and Dr. Ellen Sanders, a family medicine physician in our Oakwood office. For the next 30 minutes, we want to talk about how the COVID-19 pandemic is affecting us. For those of you not familiar with Longstreet Clinic, we are a primary care and multi-specialty clinic with 11 locations throughout North Georgia and more than 200 clinicians representing 18 medical specialties. We want to bring our panel of specialists together today for this important discussion. Thank you for tuning in to our Facebook Live listening session. We know there are many questions as Georgia begins to reopen the state about how to stay safe and the important role we each play in helping protect our vulnerable populations, such as our cancer patients, diabetic patients, obstetric patients, and geriatric patients as we begin to leave our homes a bit more and possibly begin returning to work and normal. You may be asking yourself, who is considered vulnerable? Why are they considered vulnerable, and how they can keep themselves safe, and what you can do to help. At Longstreet Clinic, we take the safety of our patients very seriously. We continue to follow CDC guidelines at all of our locations and are offering telehealth appointments when possible to our patients. Complete information about our COVID-19 response and safety measures we are taking as a clinic can be found on our website, longstreetclinic.com. I want to start things off with one of the populations we're hearing a lot about in the news, and that's the elderly population. So Dr. Sanders, can you take a few minutes to talk to us about how COVID-19 seems to be impacting this group of vulnerable patients?
Absolutely. Thank you, Dr. Locicero. So I'm a family doctor, so I see patients of all ages, children and adults, but I see many elderly patients. There on a normal day before the COVID-19 pandemic started, I probably saw more elderly patients than any other age group. However, things have changed a lot now. We know that our elderly patients are at higher risk of catching the coronavirus, and if they do catch it, of getting much sicker or possibly dying. And so I've asked my elderly patients to try to stay home as much as they can, to see me over a telehealth visit, over a phone call or a video call instead of coming to my office in person like we're all used to doing, and to keep their distance from other people in lots of other ways. When we talk about elderly patients, there's no sort of maybe magic number, but we generally think about patients who are 65 years old and older. There's nothing that sort of happens the day you turn 65 that makes you more vulnerable to infections like COVID. But generally speaking, that's the age group where we see the more serious infections of COVID becoming more common. That's both just from age itself weakening the immune system, and from the fact that as people get older, they collect more other things that we're about to talk about, like diabetes, like cancers, like heart disease, that all make your body, not as able to handle the stress of a serious infection like COVID. So for my elderly patients now, in addition to doing all the things that we're asking everybody to do to protect themselves, wearing masks when they do need to go out in public, washing their hands frequently, keeping their distance from everyone else. I'm also asking them to, kind of be the last people who start to get back out into public places and visit with other people as we think about reopening the state or sort of reopening more public life in our community. I worry a lot about my patients being in public places, in stores, in big family gatherings or big group gatherings where they're just a lot more likely than the average person to get sick and to get very seriously ill. So for right now, like a lot of my other colleagues at Longstreet, I'm offering telehealth visits where I talk to my patients over a video call typically, or for my elderly patients that don't have a smartphone and want to just get a regular call on the phone, we can do that too. So that's how I'm seeing most of my patients instead of having them come to the office, and it's just safer for them. I want them to stay healthy. For things that need to be done in the office, obviously there's some things we do that just don't work over the phone. Our office is still open for them to come into, and we're doing everything we can to make it safe. They can come get their labs done if that's what's needed. They can come get vaccines, injections, or procedures if that's what's needed right now. But I try to talk to them first, weigh all the risks and benefits of doing those things, and then decide what makes sense right now and what maybe is worth waiting a little later on.
Thank you, Dr. Sanders. Let's move on to the population of diabetic patients. Cheryl, I know you and Dr. Courtney had recently written an article that was published in the Longstreet on the Longstreet website about COVID's impact on diabetic patients. Can you share a little bit about your perspective from the diabetes perspective?
Yes, we know that people with diabetes, if they don't control their glucose levels, they're at a greater risk for infections and other comorbidities. It's hard to control your blood sugar when you're under stress. I think all of us in this environment have been stress eating. Stress eating impacts your glucose level. You may miss medications because you're not on a regular schedule anymore. People who are out of work have been sleeping later. Maybe they skip their medications. And so they lose track, and they don't want to stick their finger. They don't want to know the number, because diabetes it's like, oh, well, here I go again. And so it's very hard for patients to stay on track with their glucose levels during this time. All the different things that go into it. We talk about diet, monitoring, medications. All of those things just kind of get put on the back burner when people are under stress. People are either they stress eat or they stress don't eat, but the majority of people stress eat during this time. That increases weight gain. So with the fact of diabetes, we know that diabetes is an increased risk for increased risk for COVID-19 because of the comorbidities with the illnesses that it creates, with heart disease and strokes and so forth and so on. And it just makes it affects the immune system. It affects us in ways that we really and truly don't think about. It's been a challenge doing pump trainings on FaceTime. Having patients to download their insulin pumps to CareLink, or calling in with their glucose levels and adjusting medications over the phone, encouraging them to come into our well lab, which is the temporary lab that's set up across from the main Longstreet building, to avoid coming in, because everybody is afraid. Everybody's afraid to come in. They may have their telehealth visit, but then they don't do their labs to get their kidney function and liver functions checked and their A1C to see where they are. So when I've been following up on the back end, I've been saying, you got to go get your labs. Here's this option for the well lab. And trying to get them to stay on track as much as possible.
Thank you, Cheryl. All right, let's move to another population that I don't know that we haven't talked that much about, and these are expectant mothers. So Dr. Osorio, tell us a little bit about what you're seeing in your patient population.
So we are offering same thing as Dr. Sanders spoke about. We are offering telehealth visits to our patients, and of course, in-person visits. But we are a little bit more limited in the sense that we do have to see patients a lot more. But we're trying to keep the traffic level down. And for our OB patients, as far as why they're considered vulnerable, well, luckily, so far we have found that the pregnant patients are not at any higher risk than the general population of getting COVID or getting sick, more sick than the general population, as long as they're young and healthy. Now, if they have other comorbidities like diabetes, hypertension, heart disease, and that's a different story. And then being pregnant just adds another complexity to it. But we are, like I said, trying to do encouraging people to do telehealth visits. And then in the hospital, we are screening all our patients for COVID that come in for scheduled inductions or scheduled surgeries. And then, of course, because we always have surprises, you never know when you're going to go into labor. Anybody that gets admitted gets a rapid COVID test. So that way we decrease the risk of the patients that are healthy getting transmitted the virus, and the patients that are sick, we do take extra precautions.
Thanks, Dr. Osorio. I'll spend a little time talking about the cancer patients that I see, and then we'll go into some questions. So the cancer population is also considered particularly vulnerable for a number of reasons, and this is a population generally elderly to begin with. So at baseline, they're considered a bit more vulnerable, but also the nature of cancer makes patients a bit more susceptible to infection and complications of infection. In addition to that, treatment for cancer increases the risk of infection and complications from infection. So the things that we're doing at Longstreet, I think we're all doing. We're washing hands, not touching our face, maintaining social distance. We're also limiting traffic in the oncology clinic to patients who just need to be there because they're receiving IV or injectable therapies. Like y'all have talked about, we are doing a lot of telehealth visits, and those are by smartphone, so video chats, Zoom, FaceTime, etc. But we are also doing visits just by regular telephone, landline, flip phones, whatever. We want to stay connected with our patients during this time because I think all of our patients are under stress because of their medical condition, and then it is complicated by the just general public concern and anxiety over this COVID-19 pandemic. We're fortunate in the cancer community that we have a lot of consensus guidelines built around how we treat patients, but also these have rapidly been supplemented by guidelines around how to best treat patients during the COVID pandemic. So within a week or two of identifying that this COVID pandemic was going to affect the patient's access to care, be it surgery, biopsies, imaging, treatment, etc. Leaders in sort of each of the different fields of breast, colon, lung, etc., worked together to put out guidelines so that we could all provide the best and safest care for our patients, and that's what we're doing. I think a lot of people want to know what they can do for the community, how families can help with their patients who are either elderly or diabetic or dealing with cancer or whatever. And I think really just supporting those public guidelines that we keep talking about in terms of wearing a face cover, washing hands, keeping social distance, but also this should be a time that families maybe get to spend a little bit more time together in their staycation. I think those more technologically sophisticated, teach your mom or grandma how to use Zoom, or encourage them to upgrade their flip phone to a smartphone so that they can text and use video chat and such. So that's what I'm seeing in the world of cancer, and We're going to now kind of maybe move on to some questions that we've gotten related to this topic. So I'm going to start with Dr. Sanders. We've gotten the question, what is the situation like in nursing homes and assisted living facilities now?
Yeah, the nursing homes and assisted living facilities are some of the hardest hit places by COVID-19. That's been the case here in Gainesville and Hall County and all over the country and all over the world. It's a very vulnerable population of older folks who tend to have more than their fair share of other chronic health problems, all living in close quarters. It's just a setup for an infectious disease to spread. And so sadly, a lot of cases have spread in some of our local assisted living facilities and nursing homes to the point that it's been a real challenge for those facilities to contain it and stop the spread. They're doing their absolute best, and they've put some measures in place to help. So if you have a loved one who lives in an assisted living facility or a nursing home, you may not have been able to visit them lately. Most of them are not letting the patients come and go anymore from the facility, or the residents rather come and go from the facilities. And they're not letting family members and other people come in and visit like they used to. It's heartbreaking in a way, because I know that people want to visit their families, and it's a hard thing about the world we're living in right now. But a huge number of my patients that live in nursing home and assisted living facilities have had COVID-19. Several of my patients that have passed away have lived in those facilities. And so it's a place where we're having to take more strict steps to try to limit the number of infections among residents of these facilities. It's been a very challenging part of the COVID pandemic in a lot of different ways.
Dr. Sanders, along those lines, what are you telling grandparents in terms of how they can visit with their grandchildren? Because that's an important part of
Yeah. So, I know it's not what we want, but I've been encouraging, my patients who are older and have young grandchildren to do like what you were speaking of, Dr. LoCicero. Use that iPad, learn how to FaceTime, because it's, we think that children, although they don't often get seriously ill from COVID-19, are very good at transmitting it. And I've sort of talked to a lot of my patients about this, even though we hear in the news like, oh, children don't get it, children don't get sick. They can still infect other people. And children, particularly small children, are very good at doing that because they want to hug you and sit on your lap and kiss you. So it's a very personal choice for families and grandparents about how they want to handle things right now. But I've encouraged a lot of my older patients to try to maintain some social distance, even from the grandchildren that they love, to try to help and keep everyone healthy. I have a baby of my own, and my mother and my grandmother, who are in their 70s and 90s respectively, have not held him these past several months. And we hate that, but we're just trying to do our best to keep everyone healthy and well.
Great, thank you. All right, so let's continue with the children theme. Dr. Osorio, how will a mother's COVID positivity or not affect the delivery and breastfeeding?
So we are trying to keep moms and babies as close as possible. Taking the baby is only when absolutely necessary, which we were already encouraging that anyway, but now it's even stricter. And if a mom is COVID positive, we assume that the baby may have it as well. And so again, we don't take the baby unless we absolutely have to. But it gives them more special bonding time, which is good. And if they want to breastfeed, we still encourage that. We just recommend that, of course, they continue to follow good hand hygiene techniques and that moms wear a mask around the baby.
So it sounds like relative to social distancing, when it comes to a mom and her newborn, they're seen as one entity.
Yeah,
so they stick together.
Yep.
Very good. All right, well, let's move to, let's get a question for Cheryl. Cheryl, what are some ways to increase exercise during this time when at-risk people or diabetics and such are asked to stay home as much as possible?
If you have a level area in your yard that you can walk in, being outside is really good. You know, the sunshine helps us. It helps us to feel better. Patients have increased risk for depression with diabetes, and being inside has, I think, worsened that as well. But walking around in your yard, if you have steps in your home and you can tolerate that, go up and down steps. Steps are a great way to increase your exercise. Marching in place. How many of us have done an exercise video where we're in one place and doing that activity with something on the TV screen? We'll do that. If you're sitting watching TV, moving your arms and legs, motion helps your sugar. Motion helps your heart rate. Of anything that you can do, make sure to stay hydrated, because we do not want to get dehydrated with any activity that we do, but especially with diabetes because of the increased risk that it puts on our kidney function. So I think sometimes when we're not moving around and we're not active, we don't think about drinking that water that we need to. So staying hydrated is really, really important during this time as well.
Thank you, Cheryl. So one of the questions I've gotten from cancer patients is, what is the visitation policy? In our clinic, generally, as patients are getting their treatments and talking to their oncologists about their cancer treatment planning and such, having family and loved ones nearby is an important support system. So this has been particularly difficult for patients not to be able to have the family around because of the visitation policy. So just to clarify, the Longstreet Clinic has a COVID task force that develops policies in line with CDC guidance and guidelines. Right now, the visitation policies for Longstreet Clinic is patients younger than 18 and younger can have a guardian with them. Any patient that has a physical, cognitive, or emotional disability for which they need someone with them to protect their safety during their encounter with the clinic are general guidelines. Like I said, I just touched my face. I was not supposed to do that. Our guidelines are only patients coming in for IV therapy or injectable therapy, which has been difficult. There's been other questions about visitation for patients the end of life in hospice, particularly at the hospital, where they may have to be in an inpatient hospice scenario. Under those circumstances, there are exceptions, and visitors are allowed for patients who are under hospice care because they are at the end of life. And that is a little bit different, right, Dr. Sanders, than the nursing home population, because I think it's a much more restrictive policy in the nursing homes.
No, and I don't know specifically if there are different policies around the end of life in the nursing home facilities, but I think most of them right now are not allowing visitors on any regular basis at all.
Very good. One of the questions we got was, should gloves be worn in addition to mask when in public places? I don't know what experience you guys have had with those recommendations for your patients.
I think it's all about how you use them, because if you're going to use them as a reminder to yourself that your hands are contaminated and that you should not touch anything until you're ready to be able to take the gloves off and wash them, and everything you're touching is contaminated, then if that's helpful to you and it serves as a reminder, then it's okay to use them. I think that's would be a good way to use them. But if you're going to use them thinking that that's protecting you in a way, but you're using them as if, and then touching your face and then putting your your gloved hands in your purse and grabbing your keys and grabbing your phone, then it defeats the purpose. You can just use good hand washing technique, when you go into a place, and be conscious that your hands are now dirty, and don't touch any of those items in your purse or in your phone. Don't put your hand on your face until you're able to wash your hands, and it's the same thing as using gloves.
Very good. I think we've all gotten questions about testing. And I think one of the most recent questions I've seen and heard a lot is, what do you do when an asymptomatic patient, just to be clear, the current CDC guidelines for testing is patients who have symptoms of COVID-19 should be tested, highest priority. But the question that has come up recently is, what about the asymptomatic patient who for any number of reasons wants to know if they currently have the infection? What are y'all telling your patients? Dr. Sanders?
So right now, what I'm offering my patients is sort of in line with the CDC guidelines. We're testing people who have symptoms of COVID-19 for an acute infection. There's some availability through the Georgia Public Health Department for sort of wider spread testing of people who do not have any symptoms. Some of my patients have started to look into that. I'm not quite sure how that's all going. But right now through our lab at Longstreet, I'm ordering testing for patients who have symptoms. And those symptoms are the things that you hear of, like cough, fever, shortness of breath, but also sometimes some things that have not, until recently, we've become as widely known as symptoms of COVID. So patients who have GI upset, kind of stomach flu type symptoms, patients who've lost their sense of taste or smell, patients who have really bad chills or muscle aches. So there's certainly a variety of things that get covered as symptoms of COVID and reasons to get tested.
Thank you, Dr. Sanders. Cheryl, what are you seeing with the diabetic patients? Are they calling in and asking that question?
Yes, a lot of them are wanting to be tested. Some of them have had symptoms. They're concerned. They've had long time cough. And so, I've encouraged anyone that has been concerned about this to come on in and be tested.
All right. And so what are the logistics of that, Cheryl, in terms of getting access to testing at the Longstreet Clinic?
It has to be ordered by a physician. You may be able to speak to this more than I can because I haven't been there much, but they do have a site. They do test them. They send it off. They get the results back. Patients are notified. I think the timeliness of that has speeded up much more. They can test in urgent care. They can also, if they have the order, I think they go to the lab area for that as well. And just the reassurance factor of getting that result.
Dr. Osorio, what are you telling your pregnant women when they ask that question? Because I'm sure there's a good bit of anxiety about being in the healthcare space and their family wanting to know, the risk of infection and stuff. What are the logistics of getting testing for your patients?
So anybody that has symptoms, again, just like you guys, they call. Usually the nurse will give us a message and we will call the patient, and we can just do a telehealth visit. We can do it over the phone. We can do it over audio. And if the patient's having symptoms, then we'll go ahead and order it, and we'll instruct the patient to come through a drive-through for testing. We have a tent set up on the side of the building where they come in to be tested. And we're also testing our moms, like I mentioned earlier, when they go into the hospital for any scheduled inductions or surgeries. And they also go through the drive-through for testing, and they go in about 3 days before any scheduled procedures.
So it sounds like the process has a lot of similarities. Another thing that we've been doing with our patients is referring them either to the Longstreet Clinic website, where they can look at our COVID-19 response information, but they can also get a link there to scheduling an e-visit through the website or through the MyChart portal. And in that way, they can have a telehealth visit with one of our primary care, urgent care physicians so that they can coordinate testing as appropriate, get it all ordered, and talk about how to deal with the results and all that kind of stuff. Well, this has been an informative discussion for me. Thank you, Dr. Osorio, Dr. Sanders, and Cheryl for your time today. And thank you, listeners, for spending time with us. Please feel free to share this post if you found this information useful and feel it would be helpful for your friends and family. If you have questions we did not answer, we're always, we want to hear your questions, and we want you to feel free to send us a message through my chart, through Facebook, or give us a call. It's important to know that all of our listeners remember that care is available to you, whether it is a COVID issue or not. Do not delay care for non-COVID issues. We are here for you. So please wash your hands, don't touch your face, keep your distance, be kind, be patient. We will get through this together. We will see you next time. Thanks for joining us.
Thank you.
Bye.